New tonight, the CDC is updating its vaccine guidelines, changing how Americans get COVID shots. The agency now recommends patients consult with a doctor. The agency adopted a recommendation from a panel of vaccine advisors picked by Health and Human Services Secretary Robert F. Kennedy Jr. The advisors voted unanimously last month that people who want a COVID vaccine should consult with a healthcare provider. It's a process called shared clinical decision making. However, the advisors narrowly voted down a recommendation that a prescription should be required. It's a common respiratory virus that can cause mild symptoms similar to a cold, but RSV can be dangerous, even deadly for those who are more vulnerable. Mandy Gaither has more on what to expect this RSV season and how experts say families can be protected.
Right now in the U.S., RSV activity is low, but October is when the virus typically starts spreading, and it's dangerous to those who are most vulnerable.
It's the leading cause of hospitalizations in kids less than 1 year of age.
Dr. Juanita Mora with the American Lung Association says RSV symptoms may start mild with a runny nose and high fever, but it can travel to the lungs and cause babies and young children to be at risk for illnesses like pneumonia. She says if a child is having labored breathing, shortness of breath, wheezing, a worsening cough, or signs of dehydration like a lack of wet diapers, it's time to take them to the emergency room. But she says there is a way to protect against severe disease, the RSV vaccine. The CDC says it can be given between weeks 32 and 36 of pregnancy, or an infant RSV antibody can be given to the baby after birth.
We saw from the 2024-2025 data that by giving protection to these babies, we were able to reduce hospitalization by 50%.
Last season, the CDC estimates that from October 1st, 2024 through May 3rd, 2025, there were up to 6.5 million RSV outpatient visits, up to 350,000 hospitalizations, and up to 23,000 deaths due to RSV. This season, the agency expects peak weekly hospitalization rates across all age groups due to RSV to be similar.
Let's protect the village to help protect these babies.
For Health Minute, I'm Mandy Gaither.